welcome everyone. Thanks everyone for coming. So why are you here and why am I here? Part of it is because I really want to inform you what is going on with tick-borne illness and for you to be better informed, because knowledge is power and power allows you to access a better information that is currently not out there. So I am asking you all to be ambassadors, because the community is much larger than this. So I want you to be able to inform other people of the misinformation that is out there regarding Lyme disease. It's an epidemic. It occurs all throughout the year. The testing is inadequate and the treatment is inadequate. And most of this information that you are getting, this misinformation, is from providers. So it's when you go to the urgent care or the emergency department, or you go to your family doctor, or you go to any other provider, the information is typically incorrect. So let's start with just the basics. One is, how do you prevent? Well, that's a tough one. These bugs are very small, they're ubiquitous, it is epidemic. They are around. If you have dogs, it gives you an increased likelihood of getting exposure. They're not only in the woods, but they're actually more common in suburb areas. They're more common in your gardens. Question about, oh, well, if I get bit, it's okay because, I have to wait 24, 36, 48 hours. Misinformation. Not true. As soon as you get a bite, if there's any mark, any red mark, that means that you have a possibility of transfer of what was in the stomach of the bug to you. It may not infect you if it only was on there for 10 minutes, but it may infect you if it's been on there for an hour or 2 hours. Any mark on your skin, period. You have a tick bite, you test the tick. Why? Because the tick doesn't just carry Lyme disease. It can carry a multitude of other bacteria and viruses, and the bacteria themselves are not just treated with a single drug like doxycycline. The two other bacteria that are really you should know about are Bartonella and Babesia. Those get treated differently than Lyme disease. But the really bad guy is anaplasmosis or ehrlichiosis. Those tend to give you very ill feelings, almost relatively immediately. So one, prevention. It's very tough to prevent. Now, I'm wearing actually permethrin-treated pants. I also have permethrin-treated socks. I went out with my dog to go hiking and walking in the woods. That's probably a good way to treat yourself, is just wear permethrin-treated clothing, because otherwise it's really tough not to get bit. The ticks themselves, the nymph is as big as a poppy seed. So anyone that tells you, did you see a tick? I didn't see a tick. I didn't feel a tick. Well, the people that have Lyme disease, and in this community, if you have Lyme disease or you had a diagnosis of Lyme disease, 80% or more of you never recall ever getting bit by a tick. So asking if someone ever got bit by a tick has nothing, that's not good information. The other is, because it is epidemic all year round, you should get tested all year round. Having a single test that says that you're negative doesn't mean anything. Were you tested too early or too late? Today, we just saw someone who came in for a tick bite. He was given two pieces of misinformation. One, he had a tick bite. It was a red mark. His provider said, or her provider, or the provider said, don't worry about it, nothing to do, we're going to wait. We're going to wait for if you have symptoms, and we'll test you in 2 weeks. So 2 weeks will not raise the antibodies. The testing itself is highly inaccurate. It is a very poor test. The test has been out for 40 years. From what I know, we have really advanced medical technology. Why would you have a test that is so inaccurate? But we do. That's what we have now. If you go to your provider, there's typically a two-tier testing. The two-tier testing means that they test first what's called an ELISA test. That ELISA test is just an antibody test. It tests a general antibody for Lyme disease. That test itself is a general test. It's a two-tier test. You have to pass the first tier to get to the second tier, which is the Western blot. What is the sensitivity of the first tier test? Now, typically, tier testing, the sensitivity is very large for the first test because you want a big funnel coming in. That is not true with the two-tier test for Lyme disease. The first tier test for Lyme disease is 30 to 50% sensitive. Now, would you bring your car in if someone told you I've got a 30 to 50% chance that I can know what's wrong with it? No, you wouldn't. Why would you have a test like that? It's ridiculous. Demand something better. Demand that your provider knows more information. Okay, so testing. So let's say you do get a test, the Western blot. The Western blot itself has been limited in what's in the Western blot. Prior to about 25 years ago, when the Lyme vaccine first came out, the Lyme vaccine used one of the pieces of the bacteria, which is band 31, to make the vaccine. After that was made, two pieces of that bacteria, which are in the lab test for the Western blot, were removed from LabCorp and Quest. Why would you do that? How many here have gotten the Lyme vaccine? Nobody. It was about 10,000 people actually had it back then, but it caused problems. They stopped the testing. They stopped the administration. They never put those pieces back into the lab testing. C6 peptide. It's another test that was taken away from LabCorp and Quest 3 years ago. C6 peptide is another test, again, that we use, but can see if you have other Borrelia, not Lyme. Borrelia is the species. It's the family, but not the species. Borrelia burgdorferi is the species. The family is Borrelia, but there are other Borrelia species that you will not test positive if you have that. So, one, know that the testing is inaccurate. Okay, you get bit by a tick. What do you not want to have happen? So, one, you get bit and you get this red mark. What you don't want to have happen is if you go to a provider and they give you a single dose of doxycycline. It is like giving someone who's coming in with chest pain and having a heart attack and you give them Mylanta. That's about it. It will do absolutely nothing. Why is that? Because Lyme disease is an interesting bacteria. It's interesting to observe. It's a very complicated bacteria. It is a slow-growing bacteria. It is unlike most of the infections that a lot of you may be familiar with, like strep infections or E. coli if you get a urinary tract infection, or if you get a flu like COVID. Those are very rapid reproducers. They tend to reproduce every 10, 20 minutes. They'll double in population. That's not the case with the Lyme bacteria. The Lyme bacteria is smart. It doesn't like to hang around your blood. It doesn't reproduce fast. It can reproduce as slow as days to weeks, or as much as maybe 12 to 24 hours. What does an antibiotic do? Antibiotic only kills actively growing bacteria. It does not kill already adult bacteria. So if you miss the window of the growth, you will absolutely have done nothing. But what will you think you've done? You think you've protected yourself. You don't have Lyme disease. It being a slow-growing bacteria, what does that do for your provider? What does that do for you? Let's say you got bit today. Maybe you won't have symptoms because it's so slow growing. And you're a pretty healthy guy. You're walking around, you're sort of, you're pretty active, you eat pretty well, and you don't notice symptoms until the fall. Maybe even later. And those symptoms are weird. Maybe you got joint pain, maybe you don't. Maybe you just have palpitations. Maybe it's just your heart racing. Maybe you're just confused. You have some cognitive issues. Because Lyme is a great imitator, and because it goes so slow, it's really hard to figure it out. So one, if you get bit and you see a red mark, and you can't test the tick, then treat it for a minimum of 3 to 4 weeks. Now, doxycycline is a good drug. The problem is doxycycline now. Doxycycline is very sun sensitive. He takes doxycycline, 80% of the people that take it will have sun sensitivity, and the sun sensitivity is significant. If you don't put sunblock, you don't wear a hat, you leave your hands and fingers open, you wear open-toe shoes, you will get a sunburn. And you can get a significant sunburn. So protect yourself if someone gives you that. The other is doxycycline is a very disruptive antibiotic for the microbiome. So it really wreaks havoc on the microbiome. Doxycycline is like taking a shotgun to your gut. And it blows up a lot of other bacteria. So, not just for me, whatever. Anyone gives you an antibiotic? Probiotics. Saccharomyces boulardii is the most important. The reason why is because it's a fungal. It's not actually it's not a probiotic, it's actually a probomycotic, but it can protect from C. diff, which is the one thing you don't want to get getting on antibiotics. And the other is taking some other probiotic, and you want to take it away from the antibiotic. So that's to protect your gut. The other bad thing about doxycycline is that there's been studies that show that doxycycline alone promotes a dormant form of the bacteria. So what's good is that 90% of the bacteria are killed. What's bad is 10% aren't, which means that over time, that 10% can start now becoming an illness for you. So we never treat, except for those individual tick bites where there is no signs of infection in terms of how you feel, we never treat with a single drug. That's because the bacteria is too complicated. It's a slow-growing bacteria. It learns how to be tolerant. It is similar in its growth cycle as a familiar bacteria that is not common anymore, called Mycoplasma tuberculosis, right? Tuberculosis is a slow-growing bacteria that requires 4 drugs to treat one bacteria over the course of anywhere from 6 months to 18 months. And it causes a lot of problems if left untreated. What happens when you don't treat Lyme disease? Neurological complications, arthritic complications, gut complications, heart complications. It is the great imitator for a reason. I want to say that I feel grateful that I'm able to treat you, to treat our community. I feel grateful to be here. It is my purpose. It is really what I want to do, and I mean this for you. You have to go out there and tell people if they were not adequately informed or managed. If someone says after you got bit, we'll test you in 2 weeks, that's not going to work. It takes 3 to 6 weeks at a minimum for your body's antibodies to develop. What about other testing? PCR testing. Have anyone heard of PCR? PCR is basically a direct method testing if there is RNA or DNA within the bloodstream. So how accurate is that? It's pretty much as accurate as trying to find a needle in a haystack, right? Because it's a very slow reproducer. If it's a slow reproducer and it's a microaerophile, meaning it doesn't like to live in high oxygen environments. So it likes to get out. It's in your bloodstream, you got oxygen floating around in your bloodstream, guess what? I don't want to be there. I want to get out. I want to go to your joints, I want to go to your brain, I want to go somewhere else, but I'm not going to be in your blood. So a PCR is almost never possible unless you are acutely systemically sick immediately. And even then, if it's negative, it doesn't mean anything. It's a terrible test. So antibody testing, Western blot testing, all terrible. Why should we do this? Why? Because this is a clinical disease. Migratory joint pain. You got migratory joint pain, it's moving around it's Lyme disease until proven otherwise. Period. You're 38 years old and all of a sudden you develop dementia and you can't remember and think about things. And you've checked every other box. You've got the CAT scans, the MRIs, you went to neurology, they've done everything. They look, they do your blood test. Everything's negative. Guess what? Think Lyme disease. This is where we live. We are in an epidemic. You got your heart racing. You're otherwise pretty calm. You don't really get excited about things. You go to your doctor, they say, you just got an anxiety. No, if your heart's racing, you're going to feel anxious. Right? I would feel anxious. My heart's racing. I don't know what it is. So just demand to be listened. Demand better treatment, better information. Demand that your providers don't say, I don't know much about Lyme disease. That's like a cardiologist saying, I don't know much about heart disease. If you're an urgent care provider, an emergency room provider, a primary care provider, you need to know the epidemic that's facing us. This is what we're doing. This is why we're here. But you shouldn't have to come here to get treated. Okay, so we spoke a little about Lyme disease. What about the other co-infections? So the other co-infections, one of them is Babesia. Babesia is a really weird bacteria. It's a red blood cell parasite. So it affects the red blood cells. It actually loves iron. It loves the iron in your hemoglobin. In fact, it uses it as an energy source. What does that do as symptoms? It actually makes you feel short of breath. It makes you feel like weak. Your big muscles feel like they're not getting enough oxygen. It can give you night sweats, day sweats. It can give you chest wall pain. Really weird. Why? Because your body thinks that it needs to make more red blood cells. You test for Lyme disease, and it tests, and they don't test Babesia, then you could be treated for Lyme disease. But it's kind of like if you've got 3 nails in your foot, and I'll take out one of the nails, you tell me I got 2 other nails in my foot, I still need to be taken care of. That doesn't mean that you're fixed. So Babesia needs a specific treatment. The treatment is essentially malaria-like treatment. You treat it just like malaria. The other bacteria that we typically see is Bartonella. Bartonella is a really crazy bacteria. And in fact, it actually causes psychiatric symptoms. Bartonella as a vector can be we can get it administered to us through fleas, lice, and ticks. It's also a natural reservoir of cats. Right. So, and they don't get sick from Bartonella. So if you get a scratch, you get a bite, and you can get symptoms of Bartonella. The symptoms of Bartonella are pretty, again, strange. Neuropathy. The most common neuropathy is your feet feel like they're burning because it causes this sort of vasculitis, this inflammation of your feet. It causes numbness and tingling. Feels like someone's like having electrical impulses in your extremities, your hands, your feet. You have panic attacks that you never had before. Anxiety, panic. You typically were a good sleeper. Now you don't sleep. What's up with that bug? Like, what are you doing? It gets into your brain. So it's a scary bug. There is some belief that actually some of the homeless population that have fleas and sort of these infestations have some of that their psychiatric symptoms may actually be infectious. So those are the three major. The other is Ehrlichia anaplasmosis. If you're all of a sudden really sick and it's summer and right now, COVID is less so. COVID can do it, but not as bad anymore. Not like when we first had it. If you get really sick, you get a high fever. You're delirious. You can't really think straight. Typically, those occur in the older population. So people, my mother always said, no one's old unless they're 5 years older than me. And that was even when she was 95. So if you're like 95, if you're older in your 60s, 70s, depending on what old is, and you have that and it's occurring now, then think about anaplasmosis. Think about that. And that actually is treated with doxycycline.